Another side effect we're going to deal with is called bleeding. Now, don't let that scare you. People think, well, what does that mean? I'm just going to like bleed all over the place. What happens with chemotherapy is that chemotherapy can lower your platelet count or your white blood cells, okay? White blood cells keep you from bleeding. They're what causes the blood to clot, okay? So what can happen is that your white blood count can get down, again, because the chemo is attacking the cancer. And keep remembering, these things that are happening is because the chemo is doing its job, okay? Keep that in mind. Don't let yourself get focused on, well, I'm having all these side effects, all these terrible things that are happening. No, they're in there having a battle right now. It's fist to fist fighting, okay? And the chemo's winning, and the chemo's effectively treating the cancer. The chemo's effectively attacking the cancer. And yes, there's side effects. Okay, so what do we do with bleeding? Well, first of all, just to understand what it is, your white blood count is down. You'll hear all kinds of fancy words, all these things. You just stay focused on the fact that, okay, my white blood count's down. My blood isn't clotting as well as it should clot, and it can cause me to feel different ways, okay? Now, how do you know this is happening? Well, it can happen because you'll start to feel, maybe you get bruises and you didn't run into anything, okay? That's one sign. It may be that when you go in to get your blood tested, the blood doesn't clot very well. And then obviously, when you get your blood tested, the doctor will tell you the white blood count is down. We need to get it up. Now, they have great things to do this. They have great shots that they give you. Sometimes they give you one shot. Sometimes they let you take home and you'll do 4 shots at home. They're really thin, like insulin needles, so they're very easy to do. So don't worry about it. Don't over fret and get frustrated with that, because they're doing what? They're fighting for you, okay? So just keep that in mind. Keep the positive attitude that this is a good thing, okay? Now, let's talk about different ways that you know that your white blood count is low. Some other ways that you can know, we talked about the bruising, but you also might find that you blow your nose and you bleed a little bit, okay? You might find tiny kind of red dots sometimes on your skin for no reason. It looks like a rash, or it looks like a rash. I mean, a rash or just like tiny dots. There's these little signs, but for the most part, don't panic on these things. Just make sure you do what? You communicate to your doctor and your nurse that you're seeing some things that are a little different, okay? You might find a little bleeding in your mouth, around your gums, some situations like that. You're always communicating these things. But for the most part, they're going to bring you in, they're going to do a blood test, or they found it in a blood test that they've done on a weekly basis. Okay, so how do we manage the bleeding? Now, again, be prepared. Do the things from the very beginning so that you don't, what's best is when you find out your platelet count is down from the doctor and you didn't even know, because you're doing such a good job of managing it before it even happens. For instance, there's little things that you can do. One is that brush your teeth, get the softest toothbrush you can get, okay? Because that's where a lot of people will find out that they're bleeding, and you'll get real irritated in your mouth. So use a soft toothbrush. And then another way to kind of soften it even more, and you probably already know this, but run your toothbrush under hot water before you brush your teeth, just to soften it a little bit more. Blowing your nose. Like I told you, you can blow your nose and you find out that you're bleeding. Well, don't wait. When you're on chemotherapy, blow your nose softly, if that makes sense. It's hard for me to do, might be hard for you to do, but just remember to try to be a little bit more patient, take your time, you don't have to blow really hard and irritate things. Okay, something else you need to do in preparation and just making sure you're taking good care of yourself is when you're on chemotherapy, be careful around sharp items. Make sense? Just scissors, little pins, things like that. You want to be extra careful. And you as a teammate, you might help them understand that and remember that, because you forget. Also, you might use an electric shaver versus a razor. Okay? Just less chance of making yourself cut. Okay? So just these little things like this can make a big difference. So just preparation, being very smart. Watch out for bruising. You don't want to go play sports that are real actively aggressive towards each other, or doing things that can cause you to bruise. You don't want to bump into things. So again, it's preparation. It's just understanding that you're in a process. Treat yourself like you are. You're a superstar. You're going to win this battle. You go into it like a superstar and you prepare like a superstar. If I was a superstar of a full football team, I was a star quarterback, and we win on Saturday if I play great, or we lose on Saturday if I don't play, I got to be really careful. I got to be careful with who I am, because I'm a superstar. okay? In your battle with chemotherapy, you're a superstar. You're the patient. We got to take good care of you, and that starts with you taking good care of yourself. So it's just thinking, I've got to be prepared. I had a game this week. It's chemo. I have to continue to go through these treatments. I got to be prepared. So I'm being careful that when I go there, I'm doing the right things. I'm preparing before I go. And you're taking these little precautions, and then it's fun. If you want to call it fun, it's fun when the doctor says, "Oh boy, your platelet count is really, really low." You didn't even know. Why? You're taking such good care of yourself. And then he gives you some shots, he does some things, and you're eating well and you're doing the things to get it back under control. And don't worry, this comes back and the doctors do a good job of controlling it.